Hello everyone, I am Dr. Ponkhi Sharma, physiotherapist and founder of Curis 360 Physiotherapy Clinic, Bangalore. So today we are going to talk about a very advanced technique called IASTM or Creston technique. And this technique can be used by a physiotherapist who is certified to do IASTM technique. So let's understand what is IASTM technique. IASTM technique is Instrument Assisted Soft Tissue Mobilization. This technique is used to recover faster and it helps in both the acute and chronic condition, and it helps a lot to reduce the pain. So IASTM tool is differently designed to work on different parts of the body, and one of them looks like this. So this is used on the localized area where you have the issue. So let's understand how this actually works. In between our skin, muscles and bone, there are tissues which are called as connective tissues, and these connective tissues are made up of collagen fibers. This collagen fibers allows the muscles to slide easily, and that's how we get our flexibility, or we can turn or bend easily. But due to multiple reasons like constant pressure on an area or chronic pain or chronic injury to a specific area causes this collagen to become more dense. And as this collagen becomes more dense, the flexibility reduces, and as the flexibility reduces, it affects our muscles, stiffness arises and pain does not subside easily. To reduce this issue, this IASTM advanced technique is used, and now we are going to see how is it performed on a patient. So let's take an example that the patient is having a problem over here. Now it's not necessary that always we can do only on hands. We can also do on neck areas, we can do on back area, we can do on calf muscles. In fact, wherever there is a muscle bulk, we can easily use this technique. So we apply first a little bit of gel so that our tool slides on this easily. We can either use a gel, we can use petroleum jelly, we can also use coconut oil or some other form of oil. Basically, we want to slide this easily over there without causing much of friction between the skin and the tool. So we spread the gel a little. There are different techniques of sliding this. One of this is this way. So with a very minimal pressure, we are going to do this technique like this, sliding over there. There are techniques like on back muscles, if we have to do this blunt part of it, we can fix it up, and this we can slide it like this. And this tool is designed in such a way, contours are like that this is going to put appropriate pressure where it's required. Suppose we are doing on the spine. When we are doing on the spine, as you can see, there is a curve here. It's not going to pressure on the spine but just the side of the spine. So this tool can also be used as a diagnostic purpose, not only for the treatment, for diagnosis also it is much helpful. So how we diagnose with this is like when we slide on the area, we get little bit of roughness over there. So we get a feedback from the skin, and if there is a roughness, it shows that there are certain adhesions between the fascia and the muscles. And not only this, sometimes we get a trigger points, a hard point. If we get a hard point, we try different techniques to release that hard point. So with the help of this tool, it's not only releasing, we also get a very nice feedback from the area so that we understand whether that area is affected by adhesions or with trigger points or scar tissues. So after finding what is causing the problem, we can use different techniques with these tools to actually release that specific area. If it's a scar tissue, we use a little bit of different movements. If it's a trigger point release, we use a different movements. And if it is just a adhesion formation, we use a sliding techniques like this. So at Curis 360 Physiotherapy Clinic, we always use this advanced method of treating patients, and thousands of patients are getting recovered with this technique, specifically chronic issues like neck pain, back pain, calf muscles pain, upper back pain, hand radiating pain. So many cases been successfully treated with the help of this technique.